treatment for the AYA patient really becomes quite complex.
As far as we know, we're the first married couple on the pediatric record side. There have been many times where I've called the pediatric side to make an appointment or have a refill on a prescription, and they'd be like, "And how old is your son?"
Sometimes we don't know what to do. You have a 17-year-old diagnosed with cancer. Who treats that child? Is that child or adult? You know, it's kind of hard even to say, are they a child or an adult, and are they treated in the pediatric hospital or in the adult hospital?
Each patient is individual, and 18 is not 18. There are 18-year-olds who live at home and really need their mother and would be best in a paternalistic pediatric setting. And there are 18-year-olds who are married and are independent in their decision-making and their economics and would really be best in an adult setting. You add in the factors of where their expertise is in their disease, the data on the impact of how you're treated changing your outcome is one of those aha moments for people.
There are certainly cancer emergencies where we need to start right away, but there are, I think, other circumstances that we're learning it's probably more appropriate to slow down a little bit and take time to do things like investigate whether there's clinical trial opportunities, get a few more opinions, maybe a little crosstalk between the adult side and the pediatric side.
It was a coordinated effort where I was seeing gastroenterologists, surgeons, oncologists, the fertility doctors.
I think that people need to see that as the model, that collaborating is the way to go, not keeping patients to yourself.
As a general rule, young adults with cancer tend to be otherwise healthy and often have a situation where with aggressive care they can be cured. And so we will sometimes be willing to take a much riskier approach for a young adult than we might for, say, an older adult.
So we need to really be thoughtful about each individual and say, what's the best way that we can help save this person's life and then help them have a long, productive, happy life.
Initially, when I was told, oh, you might have cancer, the first thought was, I don't have insurance.
The adolescent and young adult population is the most underinsured population in the United States.
I did not have health insurance.
People our age have a lot of issues with that, especially if they get sick, because they haven't established themselves.
They don't have it through a job yet, and they don't expect they need it.
There's some research that shows if you're underinsured, if you have public insurance or no insurance, there's a significant delay in diagnosis. And delay in diagnosis sometimes can lead to worse outcomes.
I was emotionally distraught only because I said, well, I know that's a lot of money ahead of me.
It's raising 3 children and paying for my share of my health care has been a real struggle for us.
Once the diagnosis has been made, I think that the main role of the nurse is to kind of provide some emotional support, because obviously most patients and families are going to be in sort of in a state of shock. It's helpful for patients to have a little bit of preparation, knowing, okay, you're going to probably be in the hospital for a week, rather than them in their head sometimes thinking, oh, I just have to go spend the night and do some more tests and then I'll be able to go home.
And connecting them up with different people that, a social worker or different members of the care team that they'll meet and say, we're here for you, we're going to support you around this.
It's really important to me that I know who you are and who you are prior to your cancer diagnosis.
As a social worker, I'm kind of charged with all the non-medical issues that our patients experience. That could be adjustment to their diagnosis, loss of work or income, applying for Social Security disability, understanding how this big hospital system works.
This is so much information that we're giving you all at once.
And we've only been here since Monday morning we checked in, but you've answered more questions probably than any of the doctors have.
My mom's the only one working right now, and my dad is the one that helps me and takes care of me when I'm up here. Oh God, it's so expensive to have cancer.
Right now I'm taking chemotherapy. So far I've had 4 chemos since August, and I have 2 more to go. With me not being able to work, that's the biggest part of my worry. Plus being a single dad and trying to be strong for my daughter also, that's a big load. It's a really scary place to be. It's a lot of nights I sit and cry. I mean, ever since this leukemia, I mean, I'm so emotional, thinking that I'm finna leave her alone by herself. Yeah.
And are you depressed?
Yeah.
Which is normal.
Yeah,
I think one of the key things is for young adults to understand they're not alone, because I think the folks who do the best are people who can support sort of their emotional health just as much as their physical health. I don't know if do you know about 211?
I think the most important thing for any oncologist that really wants to address the needs of AYA patients is just to know what resources are out there and to make sure that we're doing the best for the patient.